Hi, I'm Dr. Rahman. I'm a board certified OBGYN and I want to talk about down there, specifically vaginitis. A vaginitis is an infection, inflammation within the vagina. And the three most common types of vaginitis are yeast, BV or bacterial vaginosis, and trichomonas. Of those three, trichomonas is the only one that's considered a sexually transmitted infection, meaning in order to get trichomonas, you have to be with someone that already had it. And as a result of the two of you coming together, you were given the trichomonas. And until you get rid of the trichomonas, anyone that you have sex with, you can give them trichomonas. So trichomonas will cause a vaginal inflammation infection. The other is a yeast infection. Yeast is not considered a sexually transmitted infection. Women who are prone to yeast infections are those that are diabetic, and also pregnant women are at an increased risk for developing a yeast infection. And then there's bacterial vaginosis, and that's an overgrowth of bacteria, the bacteria in the vagina, which can lead to a distinct odor, which is different from what you're accustomed to. The majority of women describe it as being a fishy odor, but it can be any type of distinct odor that alerts you. That's the beauty of the human body, that alerts you to the fact that something has changed, something is not right. I have to say, as an OBGYN, that women often are distressed by vaginitis. It's pretty common, and women often think that they can tell when they're having BV versus trichomonas versus a yeast infection. And what I've seen from experience is that's not always true. Women will think they have BV and they may have trichomonas. They may think they have yeast and actually they may have yeast and BV. And so it's hard for a woman to tell what she may or may not have, which is why it's always important to see the GYN. The problem is when you feel that it's recurrent and you don't want to be coming back and forth to the OBGYN for a recurrent problem. And that's when you need to discuss with your GYN the nature of the vaginitis, what is it, and how best you can avoid it, and what can be done prophylactically to help you avoid it and to make getting treatment easier in the future.